Now, imagine you cut your finger with a knife while cooking and the bleeding does not stop, or you had your child after circumcision, the wound and the bleeding does not also stop. After surgery, your child goes to play, comes back with so much wounds and also bruises. Could this be a problem? What is the cause of that? And yes, this condition is called hemophilia, and the World Hemophilia Day this year was celebrated on the 17th of April this year, and it's usually celebrated every year. And the focus this year was on understanding or making awareness on this disease that really, or condition that really comes with a lot of stigma. It's a bleeding disorder. And today on My Doctor Show, we talk about hemophilia, what it is, what are some of the causes, especially the genetic factor of hemophilia. And to help us discuss that in a little more detail, we have Dr. Jamila Rajab, who is a hematologist at Kenyatta National Hospital. She will be helping us understand some of the symptoms and also how to take care of a child who has hemophilia. We also in studio have Charles Njogu, who has the condition. He will also be telling us how it is like, you know, to live with the condition. Talk to us. The SMS line is free of charge, 20268. You can also call us live. The number is 0791478990, and we will be glad to respond to some of your concerns. My name is Purity Museo, and you're watching My Doctor Show. For now, I'll ask you to sit back, relax, and learn from this exciting show ahead. Now, help me welcome my special guest. Next to me is Dr. Rajab.
Good morning.
Yeah, good morning to you. Thank you so much, and welcome to My Doctor Show. We also have Charles Njogu. Thank you so much for coming to My Doctor Show today. You both welcome to the show. And maybe we will start with you, Doc. When we talk about hemophilia, it's a really complicated word. Make us understand, what is hemophilia?
Okay, hemophilia is what we call a bleeding disorder, where a patient, when they cut themselves or injure themselves, or as we are going to see later, some hemophilias may bleed even without being provoked.
Okay.
So hemophilia is a bleeding disorder where there is something wrong with the clotting mechanism of the body. Mm-hmm. Because when you cut yourself, you don't bleed forever. You bleed for a little bit, and your body has certain preventive mechanisms that stop the bleeding. Now, for hemophilias, there's something wrong with some of these mechanisms, so they continue to bleed hours, days after the injury. Mm-hmm. So there are several types of hemophilias. The hemophilias are mainly due to, let me say, lack of or deficiency of a certain factor or certain factors that help in the in stopping the clot.
Right.
All right?
Mm-hmm.
So there are many types of hemophilias. In our bodies, we have proteins that help us to stop bleeding. So hemophilia would be either total lack of certain proteins or partial lack of those particular proteins.
Right.
And patients will bleed. Mm-hmm. So there are very many different types of hemophilia. But by far, the commonest type is what we call hemophilia A, mm-hmm. which is lack of a certain protein that is called factor 8. Mm-hmm. So usually when somebody says I'm a hemophilia, they're usually, majority of them will have lack of this particular factor, which is called factor 8, mm-hmm. that is crucial in the formation of a clot to stop bleeding. Mm-hmm. And this is called hemophilia A. There's another type which is called hemophilia B, and then there are other rarer types, because these proteins that come to help us stop clotting are many. Mm-hmm. But by far, the commonest is factor 8 deficiency, which we refer to as hemophilia A.
Mm-hmm. And before we look at what causes, especially the common hemophilia that we have, maybe Charles, you would tell us, at what point did you maybe realize, or did you get to know that I'm suffering from this condition?
My parents realized that at the age of six months and about that, when I started having bruises in my body. Mm-hmm. That time they could take me to a hospital. That's where they realized I have hemophilia.
Right.
I have hemophilia A, mm-hmm. severe.
Right.
Yeah.
And Doc, you could just let us understand what are the symptoms for hemophilia, because I understand having a cut and bleeding, it's somehow normal, and also the bruises. But how do you differentiate that this is a bruise that is caused by hemophilia and not just a normal bruise?
Okay, if we take the case of hemophilia A, for example, sometimes a patient who has severe hemophilia, like for example Charles here, will bleed without even being injured. For example, he could just be going or walking around and then his knee starts to swell. So he bleeds spontaneously into his knee or any other part of the body. That is severe hemophilia.
Right.
That is not normal. All right? So that is how you would know that somebody has hemophilia. So the severe hemophilia where somebody would just bleed spontaneously as they perform their everyday duties or they're running, they can bleed into their joints, and that's when you know that somebody has hemophilia.
Right.
Then there are the less severe forms where somebody on the slightest provocation or injury, they form a very big bruise. All right? So normally for you and I, for us to get a bruise, you know, you hit yourself, you get this bruise, which is self-limiting. It doesn't extend and it doesn't, last forever. But for patients who have a bleeding disorder, this bruise will be there. You know, it may continue, it may spread beyond the level of injury, which means that the body does not have that capacity to reduce the bleeding or to stop the bleeding because they have this deficiency, right? So that's how you know the difference, right? The major issue is that these patients, some of them will bleed even without provocation or without injury if they have the severer forms, but others will have this big bruise that forms, which is not proportional to the injury that they have. And then again, the bleeding may continue for days without relenting. Yeah.
All right, talk to us. The SMS line is 20268, which is free of charge. You can also call us live. The number is 0791 478 990. In case you're joining us for the first time, we are talking about hemophilia, which is a bleeding disorder. You can either have, we're talking about some of the symptoms, bruises, abnormal bleeding, or a bleeding that does not even stop. We have Dr. Jamila Rajab, from hematologist from Kenyatta National Hospital, is just making us understand what hemophilia is and also how to live with someone, how to care for someone with hemophilia. Charles Njogu is also in studio just sharing with us his experience about living with the condition. And Doc, apart from bruises and also the bleeding, do we have other symptoms for hemophilia?
Yeah, okay, the symptoms that we see in the hospital are actually related to the bleed and the site of the bleed. Right. So a patient may come in, for example, for the case of severe hemophilia, they may come in with a swollen joint, right? And of course, some of the commonest causes of swollen joints is an infection. So maybe a healthcare provider may think this is an infection, but if they don't take good history, they may not know that this is a bleed that has occurred into the joint. Again, the hemophilias may bleed in any site of their body. They may bleed into their abdomen. They may bleed next to a vital organ like the airway for breathing, and that's, you know, an emergency. They may even, the severer types may even bleed into the brain. So the manifestations or the symptomatology are varied depending on the site of the bleed. Right. But by far the commonest is for the minor, which we call the less severe forms. They may come with bruising, or they may go to a doctor who, let's say you're going for a tooth extraction, you continue to bleed even for days after the procedure. That's when you know that this particular bleeding is abnormal, right? But then again, for the spontaneous bleeds, they may occur anywhere. They may occur anywhere in the body, and of course the patient will come with the symptomatology of the site of the bleed. Okay. Yeah.
Right, and Charles, other than the bruises that you talked earlier, did you used to experience other symptoms, as Dr. Jamila is saying?
Yeah. You could find your joint is not working. I can sit the way I'm seated here. So when I just want to walk, I feel my knees can't react very well. And very painful, very painful. And there is no bruises. Yeah.
Okay, and Doc, before we have a look at the causes, maybe we can look at the diagnosis, because there are other conditions that come with joint pains like arthritis. So how do you diagnose hemophilia? Okay,
so this is all about prolonged abnormal bleeding, or patients with severe disease will come with a bleed or a swollen part of the body, usually joints, without any provocation. It just occurs. That's for the severe disease.
Right.
So usually the first contact with the patient will be, of course, with the doctor. They come with their complaints of an abnormal swelling, or for example, like Charles has said, that they have painful, tender knees, all right? So in medical practice, the first thing we do is interview the patient, take what we call a clinical history. So you need to ask to have a high index of suspicion to be able to know that, especially if it's a male, as we're going to see later, Haemophilia A is a male disease. And I'm going to explain that when we look at how it is caused.
Yes.
So especially if you have a boy who is having, swollen, painful knees, or has bled under the skin and there's a painful bump, what we call a hematoma, then you need to carefully go into the history and have a high index of suspicion that this could be hemophilia. All right. Again, other patients are diagnosed, let's say, at surgery. When they have surgery, the doctor or the surgeon is trying to arrest the bleeding, and the bleeding just won't stop. So that's when you have the high index of suspicion that this could be hemophilia.
Right.
And then you can initiate laboratory tests that will confirm that this is a hemophilia, and these tests are readily available.
All right, because I can see Bonnie asking, thanks a lot for the program. Is hemophilia preventable or curable? I know we'll be talking about that, especially in the second part of this show. But Doc, now take us through the causes for hemophilia. What causes it?
Okay, hemophilia is a genetic disease. 70% of the hemophilias, or this deficiency of these proteins, are genetic. What do I mean by genetic? Genetic means that there's something that goes wrong with your gene makeup.
Right.
Because these proteins, your body synthesizes these proteins that help you to do the functions of the body. So this function we are talking about is the clotting function. So your body synthesizes these proteins that help you to clot. The synthesis or the making up of these proteins are directed by your DNA, which is in your genes.
Right.
So what happens is something goes wrong. We call it genetic mutation. And we have very many types of genetic diseases, right? For example, there's a type of diabetes that is a genetic disease where you're not able to make insulin. So this is one of the genetic diseases. So something goes wrong with your genetic makeup, and you are not able to synthesize these clotting proteins. So 70% of the hemophilias are due to this genetic mutation that's brought about by, we really don't know. Anybody can experience that particular genetic mutation.
Because I was almost asking you what
causes the genetic,
failure,
all right?
yeah.
So genetic mutations can occur spontaneously. Some of them have been known to be provoked by certain chemicals. We really don't know, but this can happen. And this is true for a lot of genetic disorders. And there are very many genetic disorders. Hemophilia is just one of them, all right? So 70% of these are these genetic mutations that occur, all right? Then you are not able to make this protein. The other 30% may be you have the protein, but there are certain inhibitors in your body that come up because of other diseases that will prevent this protein from performing its job properly of clotting. But then 70% is actually genetic. The other 30% is what we call acquired, that anybody can get, all right, that is usually associated with certain what we call immune diseases, where there is appearance of certain proteins that prevent your normal protein that you have from behaving properly or doing its proper job of clotting. So 70% genetic, 30% acquired, and the genetic type of hemophilia A, which is the commonest, affects males.
Okay.
All right, and I'm going to tell you how that happens.
Yes, you need to explain what happens.
I will do that.
Before then, let's get to hear from Charles whether which one did you have? Was it genetical or it was acquired?
Genetical.
Genetical,
Yeah.
right. And Doc, maybe before I could pose another question to him, when you talk about genetical, does it have anything to do with family history, you know? Yeah.
All right, you'll find that most genetic disorders are carried in families.
Right.
So usually it's passed on to the child because when the genes are passed on to the child in families, because gene exchange occurs when you get pregnant, right? And that's when you exchange genetic materials. And then you pass on, a child gets half of their genes from the father and half from the mother. So if the mother because usually like hemophilia
Now you're
A, the
explaining
abnormal
X and the
gene,
Y
yes,
chromosomes. All right.
the abnormal gene is carried on the X chromosome. So usually the mother is a carrier, and the way it affects the males is that because the male makeup is X and Y,
Right.
and we've just seen that this abnormal gene is carried on the X chromosome. And the man has only got one X chromosome. So if he happens to get that X chromosome that has the abnormal gene on it, because that abnormal gene, the gene for making the factor 8 or the factors is carried on the X chromosome. You understand that? So when the male gets the X chromosome that's affected from the mother,
Right.
and then there is the Y, because that's what the male makeup is, then he's going to manifest the disease.
Right.
Now, women don't usually, or very rarely, will get the genetic type, because when usually the female will have 2 X chromosomes, and it's very rare that both chromosomes will be affected, all right? So they have one abnormal one and they have one normal one. So the normal one is able to make enough protein, and they will not manifest the disease, because the normal X will make up enough protein for them for the function of the body. Yes.
And Doc, there's a very crucial question here. Akinyi from Migori is asking, how can you, okay, let's not talk about the preventive part of it, because we will talk about it, but she's asking, is it the same with heavy bleeding for women or even nose bleeding? When it, and heavy bleeding, she's saying categorically, when it comes to having your menses, does it have a hand in that?
Yes. Okay. Excess bleeding in females. Okay, females are very rarely affected by hemophilia A.
Right. Okay.
But there is another bleeding disorder, which is, part of the group of bleeding disorders, because bleeding disorders are many, all right? Here we're talking about hemophilia. But there's another bleeding disorder that's called von Willebrand's disease. That has been shown, it's also inherited, and has been shown to affect females. So that would be probably contribute to bleeding in females. But let me put a rider on that. Heavy menses have many other gynecological causes. And von Willebrand would be a very rare cause of abnormal bleeding.
All right.
So there are many, many other causes, gynecological causes of heavy menses. One is hormonal imbalance, right? Or maybe infection, for example. So until you rule out the more commoner causes of heavy menses in females, then you would want to consider, a bleeding disorder, right? So the issue here is that if a woman has heavy menses, all right, I will have a bleeding disorder at the back of my mind, because as a doctor, I know there are very many other commoner causes of heavy menses in females. Okay. So that's how you'd have a bleeding disorder at the back of your mind, and after you have excluded this commoner causes, then you can say, am I dealing with a bleeding disorder here? And if it is a bleeding disorder, what is the commonest bleeding disorder in female? It will not be hemophilia A, because as we have seen, hemophilia A is predominantly a male disease because of the nature of its cause, right? So I would think of other bleeding disorders like von Willebrand's.
Right.
Yes.
Okay, Charles, is hemophilia a family or genetic factor as to you? Did you have a family member, maybe a history of a family member who had the condition, or you having hemophilia was maybe another surprise to your family?
We had two brothers. I have two brothers who passed due to hemophilia.
Right.
One bleed in the head, the other one have stomach bleeding. Now, and I'm the last born in our family. Okay. So having hemophilia was not a surprise to our family.
Right.
So they knew there was a history of hemophilia. Yeah.
And Charles, we are sorry about losing your brother because of that. So how was it like, Charles, once you realized you had hemophilia, having it in mind that you've lost one of your brothers from the disease? How did you take the news? How did it affect you?
It was very discouraging and traumatizing. Before I accept myself,
right.
I go through a challenging life Before I came to realize there is other guys who have hemophilia older than me, and they are working normally.
Right.
So when I realized that, I came to realize that I will be able to be like normal person if I accept myself.
Right.
Yeah.
You met other people who encouraged you, Doc.
Yeah.
How common is hemophilia in Kenya? And if you link it with the awareness part of it, I know we'll be talking about it, you know, how common first? Where are we as a country as far as hemophilia is concerned?
Okay, the estimated prevalence or occurrence of hemophilia in Kenya is estimated at 1 in every 10,000 male population. So if you look at the Kenya population, we're probably talking about over 5,000, between 5,000 to 10,000 males affected. Now this figure could be higher, all right? We really don't have very conclusive data on how many hemophilias are affected.
Right.
Currently, in our practice, where, because I come from the largest comprehensive care center treatment for hemophilia patients, which is Kenyatta National Hospital,
Right.
we have only diagnosed about 500 patients, which means there are many patients out there. And remember, you know, the male children still being born. So we have only diagnosed 500. The other comprehensive care center is Moi Referral Hospital, where they have about 100 to about 150 patients registered and confirmed with various types of hemophilia. Right, by far which hemophilia A is the commonest. We've just recently started another comprehensive care center in Mombasa to cater for the coast region, and so far we have registered about 50 patients with hemophilia A. So you can see we are just at the tip of the iceberg.
Yes.
Yeah.
And the burden is really growing.
The burden may be growing
Yeah.
because of lack of awareness, for example, especially for the less severe form. Because when the children are born, the males are normal, there's a little bit of bleeding, the mother doesn't really know what could be causing it, and they really need to be, you know, to be affected, to have to go for surgery, for example, for them to discover that they have hemophilia. Because the mild one, you need a lot of provocation to have the prolonged bleeding. The severer ones are easily diagnosed because, like the way Charles said, even he could just bleed by, you know, trying to stand up,
Right.
and he bleeds into his joint. So that's easily diagnosed.
Right.
Right? So let me take the scenario of a mother who has a male child, and usually the diagnosis will come if it is severe. The child may bleed spontaneously, or if it's less severe, when the child starts crawling, you know, because there's a little bit of, provocation, because they're crawling or they're doing something, then they may bleed into the joints. And that's when the mother says, oh, there's something wrong with my child. I need to take this child to the hospital. And once they get to the hospital, it's very important that the healthcare provider that they come into contact to has that high index of suspicion to have a bleeding disorder as one of what we call in medicine differential diagnoses of what that patient could have. Because I said there are many other causes that can, or other diseases that may present, like if a child comes with a swollen joint, the first thing as a health provider, I'll think of an infection, because that's what we see very commonly.
Right.
So once I rule that out, then I may need to think about a bleeding disorder.
All right.
All right? Yeah.
Okay, and we want now to have a look at the complications that come with hemophilia.
Okay.
But before then, Charles, kindly just tell us, when you are diagnosed, when your parents found out that you had hemophilia, what are some of the things as a child that you could not do? What are some of the things that you could do? You know, how has it affected your life in terms of social life, you know, going to school, especially change of weather? Did it affect you in any way?
Yeah. One, you could not play with other children the way that you play. They could be distant with you a lot, because if you want to play, when you play, by the end of the day, you have bruises. So the child noticed that if you touch child, he will swell. So they distance them with me. That make me feel like abandoned by everybody.
Right.
Although my parents were very supportive to me, my brothers, other brothers and sisters are very supportive. But the other child, you could see clearly, no one want to associate with me.
Right.
That make a lot. You could ask yourself, why only me? Before I understand that hemophilia, what is hemophilia? Because I only know hemophilia. I am a hemophilia. No, nothing else.
It was never
about
taught
it.
in school.
Yeah. Nothing else about it. Only know hemophilia, and if you do this, you'll solve only that.
Okay. Doc, so much stigma that comes with hemophilia, the fact that men are more affected, so the fact that you will be rendered weak and all that. What are some of the, first I will ask you two questions. How do you address the stigma that comes with that, especially in a family setup where, whereby there is no one else who has had that kind of a condition? How do you address that?
Okay, it's a big problem because, like, you know, all genetic diseases, it's a big problem. We still have another genetic disease, which is also a blood disease that's called sickle cell. I hope you know about that. So it's the same stigma that we see in these genetic diseases because it is, you know, it is regarded as a family, and somebody might think that there's something wrong with me because I passed this particular abnormal gene to my child. So sometimes people don't want to talk about it. Families don't want to talk about it because they're stigmatized, and then they hide. And sometimes when I'm taking a history, because usually if there is a bleeding disorder, there must be a bleeding disorder in the family. Like, for example, in Charles's family, there's usually a family history. But I may mention that in a few instances, it may occur spontaneously where you don't find a very clear family history. But most of them, there's always a positive family history.
Right.
And usually we take the history from the mother's side because if she's a carrier, her brothers will be affected. All right? If you work it out, genetically, her brothers will be affected. So usually we take an intense history. Do you have this family? Do you have a family history of this kind of, you know, symptomatology in your family? And then we ask specifically about the uncles to the mother because they would be affected. And usually, sometimes you find that that information is not forthcoming because, you know, I'm already been, as a woman, I'm already been pointed out that I'm the carrier of that particular gene, all right? And you can, you know, realize how the relatives, especially on the side of where I'm married, will take that, that, you know, I have this, you know, abnormality that have brought into the family. So, you know, the issue of the stigma, you know, in different cultural settings from where we come from, where the woman would be stigmatized because she is carrying this abnormal gene, is very big. So those are some of the issues that we need to, you know, educate people. And as we're going to see later, that hemophilia is actually managed, can be managed. We do have specific treatment for hemophilia A. So we give them this information, and if this can be arrested early and you're able to access the treatment, your child will be able to live a normal life.
Okay, and just before we talk about treatment, preventive measures, especially how you, if there is a way you can prevent it from getting to your next of kin, someone was asking, for the case of the acquired hemophilia, do we have some predisposing factors to that?
So acquired hemophilia is, again, very rare, all right, very rare. We do know that there are some what we call immune disorders, the specific diseases that are called immune disorders, where your body produces abnormal proteins, we call them antibodies in medicine, that will inhibit the working of the normal protein that you have. So it's mainly associated with immune disorders, right? It's very rare, but that can occur, but very, very rare. So we call that acquired hemophilia A or B, and that can affect anybody. It can also affect females, right? So it's very rare, but that these disorders that are associated, right? Having said that, maybe to push it a little bit more, for example, the treatment that we have for hemophilia, sometimes the patients with the hemophilia A, because of being given that treatment, may also develop those antibodies to what the treatment that you're giving them, and that becomes a big problem.
Right.
Because now the medicine will not be able to help them.
Okay.
But that's, you know, a discussion for another time. So really, these are the disorders, especially immune disorders, where you can get, or, you know, you can get an acquired antibody that affects your proteins that work. But that is very rare.
Okay, and when we come back, we want now to have a look at the treatment and preventive measures for hemophilia. Talk to us. The SMS line is 20268, which is free of charge. Also, you will be given an opportunity to call us live on the second part of My Doctor Show. The number is 0791 478 990. Just stay with us because we are back after this break.
So we are off now. Okay.
Welcome back. You're watching My Doctor Show, and my name is Purity Museo. Today, our topic of discussion is hemophilia, which is a bleeding disorder. Dr. Rajab Jamila is helping us understand what hemophilia or this bleeding disorder is, which comes with a lot of abnormal bleeding. We also in studio have Charles Njogu, who has hemophilia, and he is helping us also understand how it is like to live with the condition. Talk to us. The SMS line is 20268, and this is the session that you will also be receiving your calls live. Use the number 0791 478 990. Welcome both of you to this second and last part of My Doctor Show.
Thank you.
Yes, and before we talk with Doc on the treating hemophilia, Charles, kindly just tell us, after you grew up, you started going to school, you know, your relationship life and all that. In school, you already told us that your fellow you know, pupils and students did not want to associate themselves with you. Did it maybe also affect your relationship life? How was it like?
On part of my relationship, I didn't experience any challenges with that, because I got a girlfriend who was very understandable. She was like, I don't know how to express it, but
Okay.
I could express to her what I am, understand me. She was very supportive to me. Until now, we are together, and I have a family of 2 kids and her.
Okay,
Yeah.
and we are grateful that he was able to get someone who is really understanding and supportive. Doc, earlier on, Charles was talking about losing a brother from hemophilia. Maybe you could cite for us what are some of the complications, you know, how bad can this condition be in the life of a person?
All right. Like I said, for severe hemophilia, where the patient is not able to clot a bit at all, you can have spontaneous bleeding. And the severity of the disease, you know, would be the site of the bleed. So, for example, Charles said one of his brothers bled into the brain. And if you bleed into the brain in a vital part of the brain, and something is not done immediately, you're not treated immediately, you could succumb to that particular bleed.
Right.
Again, patients can, let's say, for example, if they have trauma, they can bleed, continue to bleed. And of course, if you bleed and lose a certain volume of blood from your system, you can go into shock. And if you are not treated immediately or managed immediately, you could succumb to that shock. Again, you can bleed in a vital area. For example, the other day we had a child who had beaten themselves, and they bled. They started bleeding, and into the tongue, and it grew so big that it obstructed the breathing. So we had to do something very quickly, support the child's bleeding as we treated the child to minimize the bleed until the bleed is cleared from the body, right? So again, if you bleed in an area where your airway can be obstructed, that would actually cause you may lose a patient because of that particular bleed if you don't act quickly. So, acute bleeds can be very, you can succumb to acute bleed if you don't have access to treatment, especially if the bleed is in a vital area in the body. The other complications is that we see with bleeding, especially in the mild hemophilias, is that as they continue to bleed in joints, they get complications of those joints. And if you come to our clinic, you're going to see boys that are limping, all right, because their joints have been damaged by that continuous bleeding. And it's usually the big joints of the body where there is that bear the weight, which are usually the knees. So you're going to see lots of patients where the knees are affected and the knees don't work well. We have several patients who are even now on wheelchairs because they've had this continuous bleeds and damage to their joints, and then the joints are not able to work and they're now confined to the wheelchair.
Yes, and it has to be really bad, especially for young boys, you know. You cannot, they have to play at the end of the day. Yes,
because play is children's work.
Yeah.
So, you know, it can be very limiting. Like Charles said, he couldn't play. Even his playmates kept away from him.
Right.
Because,
okay, Doc, let's talk about treatment for hemophilia. What are some of the treatment options there are for hemophilia, you know?
Okay, hemophilia A, which is the commonest, and even hemophilia B, which is the second commonest, which is another protein that is deficient, there is treatment because we know the factor that is missing, and it's called factor 8. So factor 8 is available. Now, the availability of factor 8, it's there are several sources of this factor 8. Of course, the ultimate source is what we call we call it recombinant factor 8. This protein is recognized. We know it. It can be manufactured as a drug, and it's given as an intravenous infusion, all right, where you inject it into the vein, all right, and it is available. We'll talk about issues of availability later.
Right.
So that's the optimum or the preferred treatment of hemophilia A. Factor 8 and factor 9 is available.
Right.
You can buy it, you can inject it, and assume normal body levels so that you don't bleed.
Okay.
The other source is, for example, you have enough factor, I have enough factor. If I donate blood, we are able to use a fraction of the blood that we call plasma, all right, that has factor 8, and another fraction of your normal plasma, which has factor 8, it's called cryoprecipitate. We are able to use that for treatment, all right? Is that you have to use lots of it, all right, to prevent a bleed.
How often? Is it a one-time treatment process that you have to go through, or it's a lifetime you have to go through for the injection?
If I have, okay, let me take the example of Charles. Charles has severe hemophilia. We have done his factor levels. We know that he's categorized as a patient who has severe hemophilia, which means he can bleed spontaneously, all right? Now, the optimum or the ideal treatment for somebody like Charles would be for him to have access to that factor immediately he was diagnosed, all right? And you can prevent bleeds by maintaining normal factor levels in Charles. The way to do that is we call it prophylaxis. So what Charles would do is have access to that particular factor and inject himself maybe once or twice or 3 times a week to maintain the normal protein so that he doesn't bleed. That is the optimum and ideal treatment of a patient who has severe hemophilia.
It's a lifetime treatment
process.
It's
a lifetime process, all right. It's got complications, but we'll talk about that later because your body can now begin to react to that, but much later, all right? But that is the ideal. So if you go to countries where they have hemophilia and there is, easy access to the factor 8, which comes in a vial, as soon as the child is diagnosed, they have access to this factor. The family is taught how to give the patient this particular factor. And when the patient grows older, they are taught how to they inject themselves, just like the patients with diabetes inject themselves with insulin, and they're able to live a normal life.
All right.
Yes.
Okay, talk to us. The SMS line is free of charge. 20268. Also call us live, because this is the session that we pick your calls live. The number to use is displayed right at the bottom of your screen. Once again, you're watching My Doctor Show, and our topic of discussion today is hemophilia, which is a bleeding disorder, and we have Dr. Jamila Rajab, who is helping us understand hemophilia, and also in studio Charles Njogu, who is a hemophilia patient, who is having the condition, and is just telling us how it is like to have the condition. Charles, Doc has talked about having to inject yourself with that drug that she's talking about. Maybe which kind of treatment maybe have you been going through since you were diagnosed until today?
There before we used to have plasma and cryoprecipitate that help us to generate factor in the body. But nowadays we have available factors. That's what we use now. I also use factor 8. That's what I myself inject myself when I'm in home, and I'm not feeling that well in the body.
Okay, maybe how many times in a week do you have to inject yourself?
Yes, I do inject when I feel there is a joint is not working well. Yeah.
Okay.
When I have a bleeding, that's when I inject myself.
Maybe Doc, is Charles doing it right? Are you supposed to inject once you feel uneasy, or is there a standard, a standardized prescription for this treatment?
Okay, we have guidelines on the treatment of hemophilia. So hemophilia is just not, the severity varies, all right? So for patients who have severe disease, like I said, for example, like Charles, the ideal would be for him to prevent a bleed. We don't want him to bleed and then he comes to be treated, all right? So for the guidelines, state that for severe hemophilia, there is mild, moderate, and severe. So for severe hemophilia, where a patient is not making any factor for themselves at all because of the mutation, it would be what we call prophylaxis, so that he has access to that factor 8 and he's able to inject himself to maintain normal levels like you and I, so that there is no risk to bleed. Now, that is the ideal. There are issues to access of that factor, which we can talk about later, right? For the mild bleeders and the moderate bleeders who will not bleed until they have a severe injury or a severe, stimulation to the bleeding, usually we would want to give them, we don't put them on regular prophylaxis because of availability and expense. Then we would bleed them when there is, like they're going to surgery, for example. If we know they're bleeders, they're going to undergo circumcision, they're going to undergo some experience that will put them at a level of risk to bleed, all right? I hope that explains,
Yes,
the ones that need to inject themselves, what we call prophylaxis for the severe forms that don't have any factor at all, but the mild and severe have some level of factor, all right? And they would have to be provoked or stimulated, let's say by surgery or severe injury to bleed. Then we would, give them that prophylaxis when we anticipate that, or when they have an acute bleed, then we are able to, give them the factor and prevent it, right? So prophylactic continuous injection is recommended for the severe hemophilias.
Right.
Yes.
And before we look at now the cost of the treatment, you can pick a few questions. Someone is asking, hello, I have been feeling unwell lately. After going to hospital, I always go for full hemogram test. The result every time, ukona blood infection. What could be the cause of this? I'm Anne from Mombasa.
Oh, all right. That doesn't sound like hemophilia.
Right.
So if she has an infection, then there are several causes of the infection that would be related to blood. Maybe they need to look at the level of white cells, because white cells are the ones that prevent us from getting infections. But again, people who have low levels of white cells are, again, very rare. There are diseases that are associated with low levels of white cells. But then that particular infection would just be that they are at risk. Maybe the environment that they live in, or some practices that they do, for example, like hand washing, or just keeping clean, because bacteria is all about contamination.
Right.
So that doesn't have anything to do with hemophilia.
Hemophilia.
It could be environmental circumstances or the conditions in which they are living in that makes them at risk of getting an infection.
Okay,
Yes.
thank you so much, Anne, for your question, but you have nothing to worry about. That's what Dr. Rajab is saying. Let's pick another one. I'm Akinyi from Migori. How do you prevent? All right, before we talk about preventing now hemophilia, let's talk about the cost of treatment for hemophilia.
Okay.
Yes.
So the drug is available. There are very many pharmaceutical companies out there in the world that manufacture this factor 8 concentrate and factor 9 concentrate, the two commonest hemophilias. Okay, let me put it this way. If a patient who has an acute bleed, like an adult like Charles, comes bleeding into a hospital, it is going to cost me approximately 20 to 25,000 shillings to prevent or manage that severe bleed. 20 to 25,000 shillings a day.
That's quite expensive.
It's quite expensive because remember, this is a very purified protein. The method of production of this particular protein is quite expensive. We call it a recombinant factor 8, which is a purified protein. And it's expensive, like I have said, so 25,000 to manage an acute bleed in an adult, because we have to give them levels to take them to a level where they're not able to bleed. So I would have to give him factor worth about 20 to 25,000 shillings a day for us to contain that bleed.
Okay.
So it's quite expensive. Yes.
And we will getting at what you think should be done, because it's really expensive. Looking at it's in a national government. Now thinking about a private hospital, then I think it's like double the price.
Yeah, probably there would be some other costs that are added onto that.
Right.
Yes.
Charles, maybe because of the bleeding, and someone who has hemophilia is really sensitive to bleeding, and also to once you get a bruise, maybe you could cite for us, are there some scenarios whereby you found yourself injured and you had to be rushed to the hospital because you knew at the back of your mind this is not going to be a normal bleeding? Yeah.
When like myself, there is a time I was in a working, and I have to cut myself at the heart. So I knew I am a hemophilic, but at that time we could not have a factor 8. It was back 2010 there.
Right.
So the bleeding came. We tried to wrap it, but the bleeding would not stop. So I was rushed to hospital. I was staying in Githurai. They tried their best, although they could not understand about hemophilia. I told them I am a hemophilia, I bleed so much, but they could not understand it. I was to be transferred to Kenyatta. That's where I was being helped, where I got cryoprecipitates and managed the bleed. Yeah.
Okay. Some of the scenarios, thinking about someone in a place where they cannot access a health facility very easily, then the complications, Doc, as well, they are really much. But just before you have a look at the what could be done, the awareness part of it, maybe you could take quickly our viewers, take them through the preventive measures. So many questions on how to prevent hemophilia. Can it be prevented? The fact that you've said the common one, which is type A, the cause is not even known.
Yeah.
So
really, it cannot be prevented if it's a genetic mutation. You never know when the genetic mutation occurs, so you can't prevent it. So the only way to prevent it is to be able to detect the person that is carrying the abnormal gene. So usually what we do is that if we have a family history of bleeding, for example, like in Charles's family, we would go through his family tree and look at the mother and her sisters and her uncles and be able to, the ideal would be, of course, to do genetic testing. Genetic testing is very expensive, right? And not readily available to many people all over the world because it's expensive and it's only done in specialized laboratories.
In Kenya, do we have a center?
In Kenya, we don't have a center for genetic testing. We'd have to, right now I think we do have gene mapping in a few laboratories, but that's expensive, right? So what we would do is we go through the family tree, and since we know the inheritance pattern of the disease, we are able to cancel those particular mothers that are carrying the gene, that you're likely to get a child who, if you get a boy, the boy may get that, gene from you, all right? And it may be mild disease or severe disease or moderate disease, as we have said, right? So we are able to, you trace those family trees, and that's what we are doing right now to try and detect these families that have this abnormal gene, so that when they get pregnant, and that's what's done in all over the world, that if they're carrying a male child, then you could actually even have neonatal testing to show whether that child has been affected and how severe the disease is, and this helps you manage it. Like I said, for example, in countries where they have what shall I say, healthcare that's available to everybody, and they're able to access this factor, as soon as you know that your child has hemophilia, they don't need to have a bleed. You can go on to the treatment, especially if it is severe hemophilia, you can get replacement, and your child is able to live a normal life. Yeah.
But so far, Doc, there is no way you can prevent, if, for example, I'm a mother and I'm a carrier, there's no way I can prevent my boy from getting the disease. The only way is to maybe prevent it from becoming severe, right?
Not really prevent it from, because you see, the severity is determined already. So it's one thing is knowing that you're able to, that you have a likelihood of getting a child who has hemophilia. So it's being aware that if I have a boy child, that he will be, to get him tested early and be able to manage it with factor, all right? So if you have the genetic mutation, you can't, and you're going to have a child, all right? And if you get a boy child, they will probably get that gene from you. Yes.
And Charles, there are people who would not want to be with you in terms of relationships if they know that you are a carrier as a lady, especially for men, or even ladies would not want to be associated with males who have the condition. Maybe you could just tell our viewers the hope there is for hemophilia patients. Do you lead a normal life? Maybe just tell us, give us some hope.
Yeah, everything about hemophilia is normal. The only thing is that the clotting factor, you lack a clotting factor. Everything else is normal. You could live. Nowadays, as you can see, I have no any sign that you can say this guy have a hemophilia. The only part is when I have been injured. So everything is normal.
Everything is normal. You're leading, and
only to know that you are hemophilia and know how to manage it. That's okay.
You have something to add on that, Doc?
Yeah, and you said you called him a carrier.
No.
Oh, okay.
Like for ladies who are carriers.
Who are carriers,
yeah.
Okay.
And Doc, just take us through now. There is a lot of gap. Even for him, he didn't know what hemophilia is, The parents knew because they just had an idea because they had previous children. We have a big gap when it comes to understanding hemophilia and also awareness. I understand this year's theme was on awareness, understanding hemophilia, and also awareness. What do you think we have so much gap when it comes to understanding this condition that is really affecting so many people, considering the statistics that you are giving us, and also what do you think should be done?
Okay, so first of all is, of course, awareness. Right, awareness among the general population, that if there's, usually you'll find mothers are very discerning. If they notice something wrong with their child, they'll take the child to hospital, right? And if they can, right, even if you look at the rural areas, if a child is unwell or the mother notices something abnormal, they will try to manage it themselves. Then if they see that something is not happening, they'll take that child to the next health facility, which is usually a dispensary, or maybe just a small hospital. So it is very important that the health provider at that level of care has that high index of suspicion. Like we said, in comparison to other diseases like infections or, other diseases that afflict children, especially infections, they're much, much more common than hemophilia. So instead of just a health provider saying this could be an infection, prescribing the wrong medication and sending the child home, they should have that index of suspicion that what is this that doesn't look that infection that I may need to look for a bleeding disorder, especially if it's a male child, right? Like again, you know that some of the hemophilias are usually discovered during the circumcision sessions, all right? So the patient that bleeds for a long time, this particular disease should actually be suspected. And like, for example, for minor hemophilia, they will probably just bleed when, let's say, at circumcision. That's when they begin to bleed for days, and then somebody realizes there's something wrong here. But again, remember, even if you've been circumcised and you have an infection, you could continue bleeding. So you'll find when this particular patient goes to the hospital and they have been circumcised, the first thing in the health providers, they think of everything else except a bleeding disorder. So it's to create awareness. We do teach healthcare providers, especially the doctors, that about bleeding disorders. So they should have that index of suspicion. But then sometimes the healthcare providers that the patients come into contact with, like maybe Charles might say, maybe the first person to come across was probably another level of healthcare provider. They may not, like a nurse, for example, or somebody else. They may not have that as a high index of suspicion for them to initiate or ask that clinical history and initiate tests to confirm this disorder.
Right.
So it's all to do with awareness, right? Within the general population and then within, again, healthcare providers.
Right.
So we also need to educate healthcare providers at all levels.
Okay. Yeah. And Charles, do you share the same sentiments with Dr. Jamila? Because the World Haemophilia Day was celebrated last month, and when you compare with other conditions like World Cancer Day, the celebrations are usually all over. The health stakeholders come out really in support of that particular day. But for World Haemophilia Day, if I am not wrong, it was not so much overrated. We should be, because health at the end of the day comes first. What do you think should be done? I know you were in that particular event, but you could see the difference, right? So what do you think is the problem and what can be done?
We are trying to make sure everybody know about it. Sharing information, creating awareness to the whole world. So most of media houses, we want you to embrace us, share our information about hemophilia, so that everybody can know about hemophilia. Because not everybody know about hemophilia. The only type know about hemophilia about the level of high school. At high school, you go. There's a part about
when
genetics.
You're learning about genetics and all that.
Beyond that, nothing else. That's why we're creating awareness. We are trying to find more people. At the press, the press I stay, I try to educate everybody. When you come across this person with these conditions about this, try to reach us so that we can know if he really a hemophilia.
Okay, and I trust the health key stakeholders will just take the advice shared by you and also Dr. Jamila. Unfortunately, that's all the time we had for the show today. Dr. Jamila Rajab, I know you're shocked.
Because there's still so much to talk about. I think maybe just as a parting shot, Purity, the beauty about hemophilia is that it's a rare disease if you compare it to the other health problems that Kenyans have. But the beauty about it is that there is treatment available, and the fact that you have, relatively fewer patients affected, you can trace all of them and treat them because there is treatment available, and be able to have these boys lead a normal life so that they're not, sentenced to a life of disability and lack of opportunities.
Okay.
So if we are able to detect them, there's treatment available. There are few numbers, which makes it, a beautiful disease to trace and treat, so that, you know, male children are given an equal opportunity to life and they don't have a life of disability.
Well said. Thank you so much for your time. Thank you, Doc. It was really important having you today. And also thank you, Charles, for sharing your experience with us. We appreciate it, and we'll also would love to have you once again on My Doctor Show. Yes, that's all the time we had for the show today. Thank you so much for keeping us company. Thank you for your comments. Thank you for your contribution. We do appreciate. Remember, you can always watch or download the previous episodes from our YouTube channel. Simply go to Ebru TV Kenya or Purity Museo and pick the episode of your choice. My name is Purity Museo. My Doctor Show continues tomorrow. God bless.